Good morning, everybody. This is Dr. Rao welcoming you to start the day with me and work on your proactive wellness. So, we talked about a lot of things in the last 3 days, but I will repeat what our intention is, why we are here in the morning hour, is to really start the day such a way that we kind of nurture our inner resilience so that our bodies and minds function better and we have the tools to deal with the stress and burnout that we have in our modern lives, right? You know, I'm a physician of internal medicine and I have been uh, dealing with ancient wisdom and fusing the modern medicine with the ancient wisdom has been as let me start this time. Okay. Had been my aim to help with wellness. As a physician, I treat the illnesses, but go to the roots of illnesses and help them to change lifestyles. So that's the same thing we are doing in our wellness club in the morning, or when I come and talk on these social media platforms. So, what is a proactive wellness? That is to be proactively nurture our wellness, maintain our wellness, enjoy our wellness. So you kind of pay attention to our lifestyles a little bit and change them. And if they are really seriously wrong, then you have to reinvent them. Or if they have to tune a little bit, that's fine too. So this is an attempt just to encourage you, remind you of the importance of being proactive about wellness in our food habits, in our exercise habits, in our sleep habits, and in our thinking and emoting habits of the mind, right? The 4 pillars. So when we come here in the morning, I just want to encourage you that you could change these established habits slowly but steadily. So let's breathe together, stretch together, and be in the present. And don't be reactive, but be proactive, or just respond to your tasks rather than reactive emotion. That's what I wanted to encourage you to do it here. So we can start with deep breathing. I'm now in my living room, not in my yoga studio, as we were arranging some desks there. But I'll be back tomorrow there too. So bear with me today, and you can come up and talk to me if you need any doubts or any experiences that you want to convey to me. That would be fine too. Okay. So let's discuss these things, and then as we start the day, always start with deep breathing. I would prefer you do it at the edge of your bed before you do anything else. If you have to go to the bathroom, that's fine. Otherwise, after that, sit at the edge of the bed like this. Always sit straight with your back straight, neck straight, and then close your mouth and take deep breath through the nose. As you take the deep breath, let the abdomen rise up. And now pause for a few seconds and breathe out completely out as the abdominal wall goes towards the spine. Okay, let's do it now. That is the first one. And then second variety is where you raise both hands with elbows bent and keep your hands up staring at the camera. And I'm on the Instagram, I'm on the LinkedIn, Facebook, and YouTube also. So people on the Noomba can hear me, but people on the other channels can see me. Now, take a deep breath through the nose and raise your hands up, up, up. Extend your elbows all the way up. Now, with one stroke, breathe out, come down like that. Let's do four more. See, that is the second variety to warm up. And the third one is clench your hands like this and put them under the chin. And as you raise your elbows to the side and up and above your shoulders, let the head fall back as you take a deep breath in. At the top of the deep breath, then open your mouth and breathe out, saying the word. See, let's do a few more. Now, as you take the deep breath, keep your attention here and now. Be here and now. How? Just be aware of the breathing touch, the air touching your tip of the nose as it goes in and goes up. And also pay attention to the stretches that you have in the neck and the back and see how they feel. Okay, that's how you got to be here and now, by following what you are doing, by paying attention to what you are doing, and by paying attention to the body changes that you experience. So the aim of the Wellness Club is keep you in the present and make you breathe, make you stretch, and make you really focus your mind to one point, right? Then you go out with a attention that you nurtured in the morning and you take it to your work and pay attention to everything and not accumulate stress by reacting but responding to things. Okay, now let's prepare the body. Let you know, clench your both hands and then turn the both palms towards the camera and extend all the way up. And now take it up all the way up, elbows extended, and reach the sky and let your toes come up. You are on your toes as you sit in the chair and you are extending both your palms all the way up. Now turn to the left side and look over the left side by turning the head. And then come back to the center. Now take a deep breath, turn to the right. Now turn back, breathing out. Okay, two more. As you stay there, keep your both feet on your toes and extend the hands once again, the elbows, and now fall back with your hands at your elbows and your head. Fall back as you take a deep breath and fall forward as you breathe out. Go all the way down if you can, or go as much as you can. Now come up, all the way up, and release. Okay, that is one stretch you can easily do the whole body really. So as you stretch, as you deep breathe, as you keep your mind to the movement that you are doing, you are aligning body, breath, and the brain. Okay, remember that. That's the one important thing that we want to do. Alignment to the movement, to the breath, to the body, and all that. Okay? And you are in awareness, not in thought, but you are aware of this movement, bringing yourself to the momentary presence. That's what we are trying to cultivate. Okay? You can do variety of stretching exercises and combine with breathing and be in the moment. Then you are aware and you are aligned. Okay, let us do something different today. I'm going to show you how you can avoid neck pain and upper back pain by doing these exercises. Raise left hand, show the palm to the camera, extend the elbow, and then use the right hand, come and pick on the fingers. Place your right hand on into the front, and then pull the left hand fingers towards you. You feel the stretch in the fingers and also in the wrist. Keep it there for 3 breaths. Now, turn the left hand down, wrist is turned down, hand is down, and then place the right hand on top of the left hand and pull it towards you. Now, in yoga, you always do both sides. Now, right hand is up, facing the camera, and left hand comes on the top of the fingers and pulls them towards you. Now, turn the right hand down and place the hand on the top of the knuckles and pull the right hand towards you. Okay, and now bend the left elbow like this and place your right hand behind the left elbow and pull it towards the right shoulder and hold it there for 3 breaths. Release it and do it on the opposite hand. Right hand is pulled towards the left shoulder. Now raise the left hand, left elbow up and hold the left hand just above your head and hold the left wrist with the right hand and pull it towards the right. Always take deep breaths in and out. Now do the opposite, right hand. Okay, now place the left hand on the left shoulder and hold on to the bottom of the left elbow with the right hand and push it up. Push it up, all the way up. And hold it when you feel the stretch. Lower it down and do the same thing with the right hand. Okay, now, well, let us do some shoulder shots. Okay, just elevate as you breathe in and lower it down as you breathe out. Slow and steady. Okay, don't do any hurry. Just do it deliberately, slowly, coordinating with the breath and the movement. Okay, now raise both hands to the side, elbows completely extended, turn the palm to the sky and bring the fingers touch the shoulders. This is for the elbow. Okay, breathe in as you go in, breathe out as you come in. 1. So we have done for the upper body a little bit, and then we're going to do with the wrist and the hand. Okay, make both fists like this and go down and up. Take a deep breath in, breathe out. Keep your mind on the stretches. Feel what you are feeling in the body, the wrist, what you are feeling. Focus on that. Now open the fist and close them. Take a breath and close them, breathing out. That's it. Okay. So we have done almost to the top of the body. Now let's go to the toes and come up after to the thigh. Okay. Okay. Get up on the toes and go down and get up on the heels. Breathe in and breathe out. Okay. Now raise the one leg to the forward and extend the knee as far as you can and pointing out the toes. And come down and do the same thing opposite leg. Coordinate with your breath. As you raise, breathe in. As you come down, breathe out. Now, let's hold on to the knee, right hand holding the right knee and bring the right thigh to the abdomen. As you breathe in and breathe out. Okay. Now, you have done very minimal exercise, but when you do that, do it deliberately, slow stretch, focused, and breathing deep. Those are the principles. Okay, be here and now. Deep breath into exercises and do both sides of the body. Okay, those are the principles we go by, right? So this session is, however, it's not just about exercise, but about 7 principles I was talking about. Number 1 principle is always deep breathe. Okay, and number 2 is stretch the body. Number 3 is be in the moment. Number 4 is don't react but respond by controlling your instant reactions. Okay, and then cultivate a service attitude. You're going to do something positive for somebody in the day and cultivate the equanimity. These are the 7 principles I'm talking about. So the discussion is about how can we nurture inner resilience with proactive wellness by being proactive about our wellness. Wellness pillars are eating well, nutritious meal, and optimizing exercise, and really sleeping well or resting well, giving time for that, not only for the body, but the mind, and then really managing your mind so that you are in the present, attentive to whatever you are doing. Okay, cultivate that, and then your inner resilience will be growing and protected. But if you indulge in habits that is really causing problems with your sleep, or with your thinking too much, or you're sitting too much, not doing exercises, you can do all these exercises sitting down. That's why my setting is different today, so I'm sitting down here. Otherwise, I can show you Surya Namaskars, head to toe, so many aerobic exercises according to yoga, so many things we can do. Okay, but that all that can be done according to individual needs and according to underlying diseases and all that. So, if you are interested, you can join my wellness club. Go to my website bepal.net. bepal.net. Okay. Now, yesterday we talked about sleep a lot, and yesterday we talked about how to be attentive in the moment, right? If somebody has a question or a comment, you can DM me or you can come up and I'll be able to engage with you. Okay. Otherwise, the same principles for the proactive wellness is that breathing deeply, we're stretching well, and we are being in the present, we are being non-reactive, and we are cultivating a service attitude, and we are cultivating an equanimous attitude of taking both pleasure and pain equally and not being overly reactive. Okay, all these things you can cultivate, and basically you are managing your mind and your body. Your body with suppose it is stiff, you can stretch very well and breathe and breathe. If you need strength, hold on to the postures for a while. That's the trick. Learn the technique, hold the posture in place, 3 breaths, 5 breaths, 10 breaths, like that. I measure that. And then you can do specific asanas for specific problems. If you have a knee problem, then you can go on the toes up and down, and you can extend the knee to the front and back. And those kind of exercises are really modified for particular joint, particular cause, or particular purpose. Okay. You can have knee pain, you can have arthritis, you can have hip pain, you can have back pain, you can have shoulder pain, or neck pain, or whatever, right? But we kind of design yoga routines just for that. Okay. I'm blessed to be a physician. I'm also advanced yoga practitioner, so I kind of in yoga all day. So that's why I know when the body is developing tension in particular parts and how to relieve it right away. That you can do with functional fitness when you go to the work. That means you carry your own weight. Use the states, go up, carry your weight by yourself, and that will help you with aerobic activity, with joints, and with also some relaxation too, if you can focus on each step, right? Like that, functional fitness, we can design routines for people who are doing certain jobs, who are doing certain way their jobs. Suppose I interview a doctor and I would like to know what is his daily routine is, how much walking is involved, how much sitting is involved, how much he is yielding to the creature comfort. Suppose you want to go in a car to a couple of blocks and then park right in front of the entrance, and then go in and take elevator and go in and sit and work. There are so many areas there that not, instead of taking the car, if the weather permits, take a walk to the walkable distance. And if you go into the hospital, use the staircase instead of elevator. Try to walk in the corridors. Try to stand and dictate. Try to not to sit for too long. If you sit for half an hour, get up and walk in. These simple things, if you can incorporate, and if you are aware that these comfort, habit forming, pleasurable activities you are involved, because the modern life encourages that, that is the creature comfort problem, right? So don't be yielding to the creature comforts. Be aware of what's going on and then go from there. Okay. So today I'm going to show you a couple of more breathing exercises that you could do, which will be helpful for you in the long run. Okay. One is called Kapalabhati. What happens in Kapalabhati is you forcibly expire air, okay, while the abdominal wall is going in. So I'm going to place my right hand on the abdomen, and as I breathe out with force, that's how you do Kapalabhati. Okay, don't do the reverse way. Like that. That's just for demonstration. Normally, we do 30 to 60 to 90 at a time. But you should start very slowly, and you should not have some abdominal problems to start this. And it becomes very slow. You will maybe do 2 or 3 times, and then allow your body get used to it. Maybe increase to 5 times next time. Very slowly. First week only stay with 5 times. But then as you go next week, you can go to 10. You can do. Let me do 30 times at a time. Okay, that is a fire breath, they call it in English, just to understand. What it does is it kind of expires air forcibly and clears your head and all that. That's why it's called Kapala bhati. Kapala means the skull, right? There are so many other things you could do that will help you reduce the abdominal fat and also improve your energy. One of them is called Agnisara. That's the only one I'm going to show today. Agnisara is again abdominal wall, right? So what you do is first take a deep breath in, abdominal wall comes up, and breathe out. Now hold the breath there and move the abdominal wall up and down. So let's take a deep breath first. See, I did 10 times. You can go as much as you, but then initially again, very slow. Start very slow. Don't compete, don't compare yourself. Look at the capacity of your body, what you can do. Just do very comfortably and not in pain. If you have any pain, any discomfort, then stop. That's not yoga. Yoga should be painless. Actually, it will reduce your pain if you have some. Okay, so these practices are advanced and difficult for people to do right away. But learn the technique and start slowly. Start very very slowly and stay on there till you feel your body is comfortable, and then only do that. Don't be in competition. Don't be comparing. Okay, just help your body and mind to do what it can. Maybe it has habits of long standing that are difficult for you to change right away. Okay, so don't be driven by your mind, but driven by your body intelligence. So that means you are paying attention to the body and listening to it. Okay, so don't let your mind run away ahead of your capacity. Build slowly. But the important thing is you are committed to being proactive about your wellness. You could do any exercise. You could do, any cuisine, but select what is good for my body. There's so much knowledge about nutrition now. There's no excuse just to go out and eat in the fast foods all the time. Once in a while is okay, but all the time is bad. See, I was talking about obesity yesterday, and I wrote an ebook on that. Main things about yoga is it does address the taste factor. It does affect the body image factor, and it does address the motivation and mental aspect of obesity too. Okay, so nutrition is important, but if you are eating for pleasure, that's a problem. So if you are eating to nurture your body, to strengthen your body, to make your body function better, that's good, right? So you want to eat what is good for the body, but you may not be able to tolerate it in the beginning. But you can eat what you need to eat first, then have something that you relish. That way, that taste factor is kind of, nullified. But if you really want to overcome the taste factor, then you have to do what's called pratyahara. That means ahara means food that you are taking or taste or any stimuli. Pratyahara means you are really allowing the stimuli come, but they don't affect you. That's a good practice you can have when you go out walking and all that. Look to the sides and then facing them right there. That's also something deeper you have to go to. And then this body image problem is if you think you are the body and you are the mind instead of they are my instruments, then you have a problem with the body. How you appear, how beautiful you are, how slim you are. But what's important is how healthy you are, how energetic you are, and also body is only an instrument. The real you is the inner life force. So once you identify with that, then you don't have problems with the body image. You don't have identification of your prestige, of your confidence, everything with the body. Okay, that's another deeper aspect yoga needs. And making food pleasurable and social. That's a problem of the culture. So if you are in a diet, or if you are really don't want to eat a lot of bad foods, but you go to a party and they have full of cakes and biscuits and whatever, then you have to eat and go there and take only a couple of biscuits while being social and pleasure, right? So you got to be in control all the time. Otherwise, all these food manufacturers, everybody will sell you all sorts of foods that are not good for you. It is prevalent all over. Look at the fast food industry. Wherever you go, they are all there. So you don't want to yield to that. So if you can handle that little bit, just go for wholesome, organic, and grains can be wholesome too. But then you have to limit them. And also, you want to expend that energy by exercising. Okay, so wherever you are, you can do these stretches and do all of that. Okay, this is more like I want to bring everybody what is proactive wellness, how to be, right? And that's why the discussion. But in the wellness club, we do a breathing exercise to begin with, then the whole body stretches, then the routines of head to toe, then some salutation, then several asana sequences according to the problems people have. And I may do one day all back exercise just to help the people who are having back pain and request them. And we may do one for the neck, or we may do one for the diabetes, we may do one for the obesity. There are so many ways I can design yoga routines that will help the underlying disease. You still have to go through the treatment. You still have to really understand why you have become like that and then reverse that. So there is so much training in art for each disease. I don't advise people to stop medications and come to me. They can take the medications while learning these behavioral changes. They can first safely cut the medications and then finally withdraw. I myself, I don't have any medications on me, right? I do everything with the diet and exercise and relaxation. My main relaxation is I don't stay in the mind. I use the mind, I am in awareness, and then use thought consciousness. Okay. So these are some of the things that I want to bring it forth. Mainly, these sessions are to bring awareness and some ideas about individual problems after how to handle it. First of all, get on the journey of I want to be proactive about my wellness. Where am I? Am I well or am I ill? If I'm ill, what are the things I'm doing for that? And what are the roots of the illness? Why did I develop this illness? Start with that. That is also being proactive wellness, right? And then correct them in the night, the modern way or ancient way. But you can combine both of them. Take the wisdom from both systems, and that's what I am. I'm a modern physician, but also use ancient wisdom to help not only physical problems, mental problems, and emotional problems too. So, if you can calm your mind every day, in the morning and in the evening, that goes a long way. And if you can be reviewing your reactions every day, then you won't be reacting that much if the same situation arises next time. Okay? It's a question of retraining yourself, a question of unlearning the bad habits that you might have adopted because you didn't know. For example, you are born and then your family has this high carbohydrate diet and they make a very delicious dishes. Then you get used to them, your taste gets used to that. Before long, before you know it, you are a slave to that. And later on, you don't have that much of physical activity, but you are consuming more of the same food. You will develop fat pockets, you will develop obesity at all, right? So start first asking, where am I in the wellness? Am I taking it easy or am I pushing? Am I going to work, do all the work, but not enough time to care for myself? That kind of thing. Once you are aware of what is going on with your body, with your mind, with your emotions, then you can design these routines that will help you not only reverse those problems, maybe abate them, but also improve your energy and make you enjoy your work or your relationships, whatever you have in life. Okay? And then you can achieve a lot more by being well rather than being ill and staying in the bed and taking a lot of medications. That we do in the nursing homes because we have no other way to go about it, just to help the patient. But the same patients, if they have understood this proactive wellness and then really done some homework, some work on their own, they will be not like this, right? So keep that in mind. I just wrote a book called Diseases of Civilization, where I talk about all these diseases that are based on nutrition or lack of activity or thinking too much. Any number of modern things that we have developed are really causing problems. Then we are going to attend to the diet, exercise, and keeping calm and resting well and sleeping. If you can cultivate these basic, simple things on a daily basis without being influenced by the environment, you are doing yourself a major benefit, right? Advantage for you. So always concentrate on the roots of illness and then move the body and keep the mind silent unless you are using it. And always rest well, sleep well. If you can do this, if you move your body, keep your mind silent, and rest well, and really eat well and exercise a little bit, you will be well off. Okay. So my recommendations in the disease of civilization is, number one is treat the roots of illness along with the process of illness, right? As doctors, we treat you as you come ill and you need help, right? That is fine. But also, I always felt it's my duty as a physician to find out, if I could, is there a reason why this patient developed illness? It could be genes, it could be environment, it could be your diet, it could be whatever, right? So once we find it, whatever correctable behavior changes we can do, whatever correctable lifestyles we can do, we want to show the way to the patient, encourage them, and also make it tell them that it's so much easier for you to prevent everything. Even if you have diabetes, you can prevent a lot of complications by doing diet and exercise, right? And sleeping well and walking every day. And if they can do those simple things, then they can limit lot of time, that is complete suffering, misery, and morbidity, mortality usually die. You don't need, with the knowledge that we have, both scientific knowledge and also ancient wisdom, time tested method, you combine that according to your lifestyle, according to your situation, your resources, then you will help yourself with a lot of savings in terms of medications, hospital trips, and lack of activity and productivity and all those things. I am 69, I don't take any medications. I'm not against the medications, but I'm saying you don't use them if you don't need to. But if you allow your system to get used to the medications just to keep you alive, then that is a real problem. That's what I have. This problem with the disease of civilization, diabetes, hypercholesterol, heart disease, COPD from smoking, and also drug addiction, both prescribed medication and non-prescribed medication. So, to be proactive wellness means to be aware of what is the family history, to be aware of genome you have. You can have a genome testing, and then you will be knowing what are the vulnerabilities, both from the family history, from the genome. There are a lot of things we can do now to advise you how to arrest them, right? The extreme example is Angelina Jolie. She had a mastectomy because she has a gene that's for sure going to have her breast cancer and she will die from it. So she had bilateral mastectomy done. That's kind of, extreme maybe for somebody, but for her that was the right choice, and she wanted to live like that. So you may not be able to do so much for everything, but we are going towards that. There is a gene therapy. We are getting better results with the chemotherapy, right? We can choose according to the genome type, right? And that's a very good. Nowadays, you can get a comprehensive blood test from a very little blood, and then you can see where you are with any deficiency of elements or supplements, and then you can take them just by being proactive. That is what it is. It's not just a preventive exam once a year. Proactive wellness is a daily affair, and you want to be taking this important thing about you, and then go and do whatever you want to do with energy and with a lack of illness, or less of illness, or less of complications of the illness. You can do all of that at any stage that you are. You could be young and very vibrant, healthy, good. Maintain them. Don't develop habits unconsciously that are going to derail that wellness. Right? If you are middle age, you're just developing illnesses because of your lifestyle. Pay attention to that right now. And then if you are old and you have some diseases, find the ways how you can limit them. Okay? You can do all these things. Okay? Yoga can extend the life longevity very well. Not only extend, but extend it well enough so that you are well for a long time and in a joyous spirit, not miserable. You have energy, you have enthusiasm, you have confidence to pursue good things. Okay? So, I think we're at another 10-15 minutes we can go on this. Couple of other things I want to show you today is, I think one more thing will be, that is, how can we observe our thoughts? That's one of the 7 principles. Observe the thoughts. Okay. As you learn to calm your mind and breath and body and sit in silence, and thoughts will come. Stimuli will be there. And then just to watch the thoughts instead of engaging in them or suppressing them. So what you do is very simple way to do it. That is, just sit down, keep both your feet firmly planted on the floor, and then keep your eyes closed a little bit, and then focus on the breath. Feel the air coming in and out of the nose, and try to be there for a few minutes. And lots of times people cannot be there more than 2 or 3 minutes or 5 minutes, but some of the advanced meditators can stay there for 45. But here, normally, there will be a thought coming up from the past or from the future worries that you have, or something that just to come up from the subconscious. So when they come up, close the eyes and follow the thought. Don't say, I shouldn't be having this thought. Don't say, I should pursue this and see what's going. If you want, your aim here is in this moment to be watching the thoughts. Watching, the observer, the witness is the real you. That thoughts are happening to you. You are not happening to the thoughts. Right? So close your eyes and try to focus on the breath and keep your attention stable. And then if a thought should pop up, follow that like you're following a cloud in the sky from one end to other end. It is coming, growing, and because you are not indulging it, it doesn't associate other thoughts. And because you are not trying to suppress it, it also doesn't get the negative flow. So it will go and disappear. That is not that easy in the beginning, but then just focus on your movement, on the breath, on attention to the touch of the breath, to the tip of the nose, right? And then keep on watching. Maybe do 10 breaths, 10 deep breaths. And if any thought should arise in these 10 breaths, just watch it. That's it. Okay. 10 times they are done. Okay. So cultivate that habit of extending that few minutes more, not only in the morning, but also at the end of the day. Do that, and you will develop slowing the thought and following one thought and going beyond one of that thought. Okay. All these are long-term things, and you have never done anything like this. You allowed your thought continuously run. It will build on itself. It will have the hardwiring of the thought patterns, and that's going to be difficult to get rid of. Okay, but the same process, the reversal. Okay? Think and do stuff, but learn to stop thinking. Learn to not think all the time, and also don't absorb so much information that's not relevant to you all the time. Try to vacate the mind at the night. That will be wonderful. We'll talk more about it as we go along. Many people do different kinds of thought patterns and meditations, mindfulness, and all that. Whatever you do, keep it up. Keep mind empty as much as possible if you could. If not, at least observe the thoughts. Okay. So we are at the nearing of the hour here, and I will be coming here every day for 1 hour, starting at 8 a.m. Central. Today is the 4th day. I will be continuing on most of these channels as far as I'm coming for the 1 hour in the morning. And if you need to send any DM to me, do that on Vibe, Instagram, Facebook, LinkedIn, YouTube, Twitter, any of the channels. If you send me the DM, I'll be happy to engage with you. If you want to work with me in the Wellness Club, go to my website, bapal.net. I usually do this hour in the morning or in the evening. Actually, I enjoy doing this with the people, but then people come with the different problems. So we may have to prescribe certain specific routines for them, which I'm happy to do. And we give them a comprehensive self-care advice. Okay? Thank you, and thank you for being here and staying with me. And hopefully, you will be proactive with your wellness starting today. If you are already maybe improvise whatever problems you have or don't have. So if you have any experience, you can come and share with me. Otherwise, I'll see you back tomorrow at 8 a.m. Central. Thank you.